All right, thank you everyone for joining today. Good afternoon, and thank you for joining the Bite Back webinar for nutrition and breast cancer risk reduction. My name is Renata Castro, and I am the clinical data coordinator here at the Hennessy Institute, and I'll be the moderator for today's webinar. So for the agenda today, so we'll first kick off with the Hennessy Institute's mission, and then we will have a featured presentation on the latest findings and practical strategies for nutritional management and breast cancer risk reduction. Then we will have Dr. Patel's patient Melissa share her personal experience. And lastly, the webinar will conclude with an interactive Q&A and closing remarks. To kick off the webinar and present our main speaker, the breast oncologist, cancer genetics specialist, and medical director of the Hennessy Institute, Dr. Elias Obeid.
Thank you, Renata. So thanks everyone for joining us today on this very informative webinar that will be presented by Dr. Patel. So just to give you a little bit of information on the Hennessy Institute for Cancer Prevention and Applied Molecular Medicine, we provide personalized cancer risk assessment and genetic testing for individuals who are interested in taking charge of their cancer risk. For those who have a genetic predisposition, we help them through the process. And those who just have a family history or maybe risk factors for cancer, we help them with a personalized approach to their cancer risk assessment and prevention strategies, as well as early cancer detection. What you can do is just take our free, quick, and confidential risk assessment survey. You can open your camera from your smartphones, just hover your camera over the QR code that you can see on the screen, and then you will get a link to your smartphone, and this way you can uh, put your information as well as get a personalized risk assessment, and one of our team members will be in touch with you. We can also have the link for the questionnaire in the chat box, and you can also click on it if you did not want to do it through your phone. With this, I'm going to move to introduce Dr. Patel. Next slide, please. Dr. Patel is the medical director of the breast program at Jersey Shore University Medical Center. She is a fellowship-trained breast surgical oncologist. She's the former New Hampshire State Chair for the American College of Surgeons Commission on Cancer. Dr. Patel is a leader in nutrition and breast cancer. She's an advocate for this, and she has over 15 years of experience. She's a passionate advocate for the power of nutrition and cancer. She is renowned for her unique supermarket tours where she teaches individuals on how to leverage food as a practical tool for risk reduction, for recovery, as well as long-term health. She won a national award for nutrition and exercise-based support groups that have improved her patient outcomes. And with this, Dr. Patel, thank you for giving us your time, and thanks for your insight on this topic.
Thank you. If we could have the next slide, Dr. Obeid, I'd like to thank you for that wonderful introduction. Good afternoon. So whether we like it or not, we all have breast cancer risk, and it can be due to family history or because of a genetic risk for breast cancer. Believe it or not, our environment and our choices that we make on a daily basis can affect our lifestyle choices and our risk for breast cancer. So if we could skip to the next slide. And the next slide, please. So there's three types of breast cancer risk. One is hereditary. So sometimes we may have a change in our DNA, and there's certain genetic risk factors that may make our breast cancer risk up to 70 to 80%, like the BRCA gene. As you all well know, Angelina Jolie has this gene. There's other genetic changes as well. There's other gene mutations that may give you a 20 to 40% lifestyle risk of breast cancer. And then the risk that you have depends on the genetic change. And sometimes some of these gene mutations can also increase the risk of other cancers. It's important to know your risks so that we can help screen for these risks. So the genetic risks account for 5 to 10% of all breast cancers. Familial risk are patients who may have a strong family history. Even if they don't have a known genetic mutation, there's still a lot of things that we have not discovered about cancer risk. So again, in your situation, it's important to be screened by an appropriate specialist. And these account for 5 to 10% of cancers. There are risk factors that we can actually impact, and these are the lifestyle and environmental risk factors. So things like diet, exercise, alcohol use, and weight account for 20 to 30% of breast cancers. If we could have the next slide. So we can fight with early detection. And so for a lot of us, things are getting confusing because there's been a lot of changes in technology. A mammogram is an X-ray of the breast, and compared to the older mammography technology, we now have mammography that takes 1 millimeter thin slices of pictures through the breast. This is called a 3D mammogram. One of the fears that patients have is, am I going to get a significant amount of radiation dose? But all of our facilities are outfitted with smart technology, and that means that you're getting a 3D mammogram with less radiation. And the amount of radiation that you get from a mammogram is actually less than what you're exposed to in your daily environment on a monthly basis. It's a good way to get a good overview of the breast, and it's the only imaging modality that gives us a good idea of some calcium patterns in the breast that may signify an early cancer. If you have dense breast tissue, we recommend supplementing your mammogram with ultrasound. Not all states will cover this, but in the state of New Jersey, supplemental ultrasound screening is covered. And ultrasound uses sound waves to look at the breast. And finally, for women that may have elevated risk of breast cancer, annual breast MRI is recommended in addition to the mammogram and ultrasound. An MRI is using a magnet, it's not radiation, and they inject a contrast called gadolinium to highlight blood flow to the breast and potentially highlight any abnormal findings. It is also important for me to mention that any woman who's had chest wall radiation prior to the age of 30 also qualifies for high-risk screening. So if you do have elevated risk for breast cancer due to chest wall radiation, family history, or having a gene, we recommend starting mammograms at the age of 30, and MRI screening should start at the age of 25. Again, if you talk to your doctor or talk to one of our specialists at the Hackensack Institute for Cancer Risk Assessment, we can get you fast-tracked for your high-risk screening plan. Next slide. So how does our plate impact your risk? Next slide. So one of the biggest questions I was asked when I started my practice in New Hampshire was, I'm on this new diet, and it's really going to help me get healthier and help me get healthier really fast. And this question came about because when I started fresh out of fellowship, I was so focused on getting my patients to exercise and helping them with rehabilitation with the physical therapist after the cancer surgery. And a lot of them were starting to feel better. They were feeling stronger, but then they raised these questions to me. And to be perfectly honest with you, we're not trained in medical school about diet, right? We have our basic science classes. So people were coming into my office and I was overwhelmed with the articles and books. And as I read through them, I found that a lot of the diets were not very balanced. Some of them have these point system, and there's really no way for the patients to track what they're really taking except for points. So they don't really have an understanding of what they're eating. So if you look at the next slide, believe it or not, again, I cracked open my biochemistry book to look at everything, and I looked at all the pathways, and I realized, what we learned in medical school is very important. So a lot of times carbohydrates are villainized when you look at the internet, when you look at ads on TV, and certainly eating too much carbs can be a big problem. So you'll learn a little bit more about starch, sugars in a moment, but really what it is that we eat fats, starch, and protein in our diet, and there's an interplay of these nutrients. And if you eat too much of anything, it's going to get stored as fat. And believe it or not, your brain can only use sugar as an energy source. It uses 20% of your body's energy. So while a lot of people promote certain diets where they're gaining their nutrition and energy levels from fat, those do help with weight loss. but the brain still needs to have some source of sugar for energy. And a lot of times, if you have a deficit of starch storage in your body, you're going to break down protein to make that sugar. So everything is interrelated and it's very complex, and you really have to have a basic understanding of this science. Next slide. So again, starches have been villainized. And so if you look, anytime you eat a sugary diet, what happens is your blood sugar goes up pretty fast. If you eat something called a disaccharide, it's still going to be quickly digested. Starch is just a complex chain of sugar. And even though your sugars aren't going to spike as quickly as a sugary meal, it's going to be digested more quickly than protein and fat in the diet. So if you eat a meal that's really high in starch, you're still going to get some sugar spikes, even though maybe a little bit later than just eating a sugary meal. Next slide. So glucose is your basic fuel, and it's the fastest way to make energy when you need it. So if you eat a starchy meal or if you have glucose, again, right away, it's used for energy, and you get these insulin surges, and one of two things will happen if you have too many simple carbohydrates. It'll initially get stored as a chain of sugar called glycogen, but that glycogen is too heavy and it weighs too much. So the easiest way to store these excess carbohydrates is as fat. And again, if you're eating a lot of protein or too many calories in your diet, it's going to get stored as fat. Next slide. So we really need to balance our plates, and the American plate guidelines have changed significantly in the last 5 years. We recommend eating a plate that has 35% of vegetables. And why the vegetables? A lot of times they have fiber, which I'll talk about shortly. That's good for us. They have a lot of vitamins and minerals. So if you're getting a nice balanced plate with vegetables and that rainbow color, chances are that you're going to get most of the minerals that you need in your diet. Protein should be about 25% of your plate, and we recommend whole grains, being these whole grains generally are more what we call complex carbohydrates, and that they have starch, fiber, and some degree of protein. And we recommend eating fruits. Again, fruits do have a lot of antioxidants and vitamins and minerals in them. We recommend eating fruits that have less sugar in them. And so again, you'll get natural sweetness with the fruits. Next slide. So the breakdown is as follows. Protein, we say most people will need about 40 to 60 grams a day. There is a more complex equation to calculate your protein intake, but I tell most of my patients, if you take your weight in pounds and divide it by 2.5, you'll get a rough estimate of what you need. Sodium, if you eat too much of it, we tend to retain more water, and it's not good for our heart and kidney health. So we recommend less than 2 grams a day. Sugar can cause inflammation in the body if you're eating too much of it. And so when we talk about added sugar, what I mean is if I add a teaspoon of sugar to a bowl of fruit, that teaspoon is the added sugar. So women should have no more than 6 added teaspoons or 24 grams of sugar. Men can have more. They get 9 or 36 grams of added sugar a day. Fiber is very important. And the reason why I'll stress this is that fiber is very good for your gut microbiome. So believe it or not, a lot of the bacteria on our skin and our digestive tract, even in our breast tissue, are being studied because somehow they may interact with our immune system to help fight inflammation in the body. So this is an area of research. They did a study on patients with melanoma, and they found in these patients that had melanoma that there's a certain bacteria in the digestive tract that was helping some of the medications to fight the cancer. And this is why this area is really exploded. So again, try to get that fiber in your diet. Avoid artificial sweeteners. And when I'm talking about the artificial sweeteners, I'm talking about what's in those pink, blue, and yellow packets. The reason for this is because it's bad for those bacteria that I was just telling you about. But in addition, these sweeteners tend to increase our cravings for food and sweets. So then we tend to eat more when we're using these things in our food. And you want to get complex carbohydrates. So complex means that there's fiber, and a lot of times there's protein. So for example, legumes have carbohydrate, fiber, and protein. And the carbohydrate or starch ratio to fiber should be less than 5 grams of starch to 1 gram of fiber. We shouldn't have any trans fats in the foods. That was outlawed by the FDA. And saturated fat, which is a bad fat, it's bad for your blood vessels, it's bad for your heart health, should be less than 20 grams a day for most people. Next slide. So how much should I eat? So for somebody who's sedentary, we recommend 10 calories a day per pound. So let's say that I weigh 150 pounds. I should eat 1,500 calories a day to maintain my body weight. If I'm moderately active, which is kind of the category that I fit into, I can have 13 calories a pound per day. And somebody who's an elite runner, who is an athlete, can probably have 15 calories or more, depending on what their activity level is, to maintain their weight. Let's say that you want to lose weight. You shouldn't try to lose more than 1 to 2 pounds per week. And in order to lose that weight, your deficit should be 500 calories. So you could lose it by exercising, eating 500 calories less a day, or a combination of eating less and exercise. But eating less than 1,125 calories a day is very dangerous and actually can slow down your metabolism. So please be mindful and make sure that you're eating enough. Next slide. So some important life lessons. How should we be eating? So if you look at the next slide, a lot of my patients in New Hampshire would come in with this concept of this heart healthy breakfast. And you remember these from the ads on TV. You see these restaurants, and it looks great, having a plate full of pancakes. And a lot of my patients would tell me, well, Dr. Patel, I'm eating hash browns, so I'm getting vegetables with my breakfast. And then all the meat, bacon. So they're like, yep, I'm getting plenty of protein on my plate. So this is what a lot of them thought was a healthy diet. And so I had a lot of work to do with them. And if you look at the breakdown on the next slide of one of these meals, there's a lot of calories in that plate. And most of us are supposed to eat about 1,500 calories a day. They're getting that in one meal. Okay. You can see the amount of saturated fat is more than 20 grams. It's a lot of protein. I agree with them, but you really shouldn't have more than 20 grams of protein per meal, because again, we talked about storing those excess calories, and sometimes it's excreted if you eat too much. Too much added sugar. For the woman who's eating this plate, she only gets 2 grams more of sugar that day, and there's really not a lot of fiber from those hash browns. Next slide. So I try to simplify things. And so here's one of my fancy breakfasts. Honestly, on most days, I have a small piece of fruit, an egg, and a whole grain toast, and a cup of coffee before I run to work, especially on days where I have to operate early. But on weekends, when I have a little bit more time, I may make like a chicken or turkey bacon that's healthier. I love avocado, and an avocado has 9 to 14 grams of fiber in it. Not everybody likes it. It's a texture thing. I'll have a cup of coffee with a little bit of milk, cinnamon. Sometimes I'll add a packet of sugar, so a packet's 2 grams. And then in the fall, pomegranates are in season. So around this time, I'll generally have 4 ounces of pomegranate juice. The reason is that pomegranates are actually full of antioxidants. It's also good for brain health. So there's been studies at UCLA that have done studies on patients with Alzheimer's disease, and the pomegranate has something in it that's actually helping the patient. So that's also being studied. So I do add that whenever I can and when they're in season. Next slide. So when you look at the breakdown of my fancy breakfast versus the average American breakfast, you can see that my caloric intake was a lot less. I had just the right amount of protein, and I had 1/2 to 1/3 of the amount of the daily recommended fiber intake, and not a lot of added sugar. And if we click a little bit, we'll see the comparison from the American breakfast that should show up, and then just highlight my total. And you can see a huge difference. So if we click one more time, it'll highlight my total. So again, just saying that this is a better balanced breakfast, and I can tell you that I will last through up to lunchtime without having to eat any snacks or anything with this meal. Next slide. So my energy balance on most days is 1, and that I'm burning energy because I'm running around operating on my feet all day, and I'm eating a balanced diet. But then the question is, what should we be doing for exercise? So next slide. So the exercise guidelines are followed. Moderate exercise is 150 minutes a week of exercising to where You are out of breath, but you can still carry on a conversation. So a lot of times on weekdays during my lunch hour, I'll take a quick 15-minute walk. If I have time, we'll do 30, or we'll break it up into 2 15-minute sessions, but I try to walk 30 minutes a day. And then aerobic exercise is to where you exercise and you're out of breath and you can't have a conversation. So breaking that down into 3 25-minute sessions a week works for a lot of people. Strength training is very important. As we get older, our bone density decreases. So this helps with bone health, but also helps to make our muscles stronger. So we recommend a couple sessions a week and 30 to 60 minutes per session. Flexibility is important, and I admit that I'm guilty of not stretching sometimes, and I pay the price the next day when I get out of work and I'm like, all right, I have to go work out, and I completely forget to stretch, and then my ankle or knee is hurting the next day, and I'm wondering why. So make sure you stretch before you exercise. Next slide. And just to mention previously, so if you exercise, it reduces your risk of breast cancer by 20 to 30%. And in women who have had breast cancer, it decreases the risk of recurrence by 31 to 50% and improves survival by 46 to 50%. So there's something called metabolic syndrome, and this has been studied quite a bit. And what it is having any three of the following: high blood pressure, elevated sugars in the blood, elevated fats, low levels of healthy cholesterol known as HDL cholesterol, and a larger waistline. So again, if you have 3 or 5 of these things, it increases your risk of cancer, increases your risk of heart disease, and other chronic medical conditions. But you can reverse this and you can also develop it. So if you weren't having these issues prior to your cancer treatment, a lot of times cancer treatment can be debilitating, and a lot of my patients have had issues with developing metabolic syndrome if they're not able to move around much during cancer treatment or eat properly. So let's look at the next slide. So prior to me leaving Dartmouth, I actually did a survey with some of my patients because my plan was to work on some grants in conjunction with some of my community partners. It didn't happen, and I ended up moving to New Jersey. But the reason why I did this is that I had observed that a lot of the patients that were being followed by my clinics were not needing medications for high blood pressure. A lot of them were reducing their needs for diabetes medications and triglyceride medications. I had one patient who no longer needed her Parkinson's medication, and I was wondering why. So I just did a quick survey. I sent this to about 400 patients, 114 responded, and I had complete results from 92 of them. And if you look, those patients that did modify their diet and exercise, a lot of them lost weight. And there's also a large number of them that not only lost weight, but also noted a decrease in pant size. And the reason why I bring up the decrease in pant size, I have a lot of patients that are making changes and they're frustrated because they don't see the number on the scale changing. It's like, Dr. P, I still weigh the same. And I'm like, okay, well, did you change your pant size? Absolutely. So the reason for that is you're building your muscle strength. Muscle weighs more than fat. So the same volume of muscle weighs more than the same volume of fat. So if you're noticing that you're dropping 1 or 2 pant sizes, but the weight stays the same, that's still good. Let's look at the next slide. So hydration is important because it helps to flush toxins from the body. And for a lot of my patients that are getting chemotherapy, they may have issues with constipation, which is common. So I do work with them quite a bit on hydrating. It also helps maintain your skin health and will help support proper digestion and nutrient absorption. Next slide. So plain water is best most of the time, but remember that if you're sweating or if you have issues with diarrhea or your digestive function, you may lose salts or electrolytes. So my trick is to add fruits. You could add lemon, cucumber, and mint for flavor. You can add a piece of watermelon, pineapple to your water, and you're going to get the electrolytes from that. And the reason why I prefer this is that a lot of the energy drinks have a lot of added sugar in them. Alternatively, if they're low in sugar, they have artificial sweetener. So you're better off hydrating and adding fruits to your water. You can use herbal teas or coconut water. Again, just watch the added sugar. And pale yellow is ideal for a urine color. If it's lighter, that means that you're pretty well hydrated. Make sure you don't drink in one setting. Sometimes I'm guilty of that when I'm operating and I feel thirsty when I get out and I'll drink 2 bottles of water. It doesn't help because it gets out of my system within the next hour. So you want to drink in small amounts throughout the day. Next slide. And then I just want to finish up with one of my real life success stories. So I had a lot of patients like this in my previous practice. This patient was morbidly obese and she had high blood pressure, diabetes, and suffered from alcoholism. And I initially operated on her because she had a lesion in her left breast that elevated her risk for breast cancer. I removed it. Thankfully, everything was fine. She was lost to follow up. And every time she came to my office, I would nag her about changing her lifestyle because I was worried about her breast cancer risk. So I wonder if that's why she wasn't coming in. But she did develop cancer and I took care of her. Thankfully, it was caught early, but she still didn't make any changes. The time when she made the changes was when I had to operate on the right side, and she also had a lesion that was a marker for risk on the right side. And that's what prompted her to say, I'm not helping myself. Dr. Patel's been telling me this stuff all along. So she disappeared for a little bit. She started going to the gym and changed her habits, and she stopped drinking. And I didn't recognize her when she came in to see me. She was sitting in the waiting area and like, who is that? And it was this patient. She did this on her own just by following the recommendations that I had made, and she reduced her cancer risk and improved her survival. And with that, I'm going to introduce one of my lovely patients, Melissa, who unfortunately was diagnosed with breast cancer within the last year, and she's been undergoing some treatments. But she has made some of the changes that I recommended for her, and it's really changed the way she feels. So I'll switch over to her and let her talk.
Hi, Dr. Patel, and thank you guys for everything you do for us patients. I know Dr. Patel the other day just wanted me to start off quickly with my story. So I was diagnosed about a year ago now, but leading up to that diagnosis, I had two major things happen in my life. One, which was being the victim of an attack, and the other was my brother unexpectedly passing away. So I was eating like complete crap. I was drinking to cope with it. I got a second job in a restaurant. So like you're just eating whatever gross stuff's around, or you're eating late or drinking with your coworkers. And then I felt something in November of last year, and I just I knew. So I started out with an initial surgeon who was suggested to me through another physician. And while it's like not a popularity contest, the guy just had no personality. And knowing what I know now, it's so important to like develop that rapport with your doctor in order just to get through. So I ended up doing like all the paperwork, the insurance stuff, because his office was a disaster. And I went for my MRI and I looked at the results on the portal as it's, ready for us right away. And I was like, all right, I'm going to need a mastectomy. There's no way around it. I could not get in touch with my surgeon. He never reached out or called me. So I talked to my friends at University Radiology, and they all loved Dr. Patel. So I called that day, and it was a Friday. She called me back 6 p.m. on a Friday and said, if you were my patient, this is what I would do. And I said, well, can you just be my doctor? So thank God she was, and thank God for her team, because that original oncologist did not call me back with MRI results until I was in surgery for my mastectomy, which is insane considering I'm 45 years old, I'm premenopausal, and I had invasive breast cancer and a lot going on over here. So based on all of that, one of the first things Dr. Patel did for us was just laid out all of these pamphlets on everything, like you have to do, everything coming up, who to talk to, and it can get really, really overwhelming. So that's why it was so important to have her as my contact and her team as my contact, because if I went to a separate dietitian or nutritionist, that's like two more, appointments I have to go to, more people to build a rapport with. And you're already so tired, so scared, and so overwhelmed. Plus, these other providers might not have the experience to suggest things as it's specific to breast cancer patients. So it was really important to go through like everything she laid out, but also she's scary, even though I love her. So it's like, I don't want to disappoint her, but that's where the relationship comes in as well. Sorry, but I'm just like, for we all know what to do, I guess. It's just how we do it, or information changing so much. Like when you don't have cancer, it's hard enough to stay fit and like lose weight and be healthy. But this is kind of like a rock bottom. It kicks your ass right into it. Like whereas before it might have been vanity, now it's literally life or death. Like it's your life. It's how you're going to heal. It's how you're going to go through treatment. It's how you're going to relate to everything mentally. Because you have to start mourning your old body and your old life. And the best way to do that is to start building a new and better one. Like that's what I've done. And I was trying to lose weight for so long, and I can't believe that I've lost 20 pounds and also gained muscle, and even went down in my arms, specifically my right arm, for lymphedema in physical therapy. I just got measured yesterday. So given all, and I just started tamoxifen, sorry. So given all of this, I'm the person who I would think, who I would never think was going to lose the weight in this kind of setting and lifestyle. Like, again, sorry, I'm rambling, but you're just like depressed, you're mourning, you don't know how to, you might not even have like the money to figure this out or travel or meal prep. Like it's just so overwhelming. So what I did pretty much was take all of her information, and it took a lot of the guesswork out of me having to like vet every single ingredient. Like I could kind of look at it a little more generally, which when you have absolutely no energy, or you physically just can't cook or reach up to those cabinets, it's like invaluable. It's the only way you're going to eat unless you order DoorDash every second or fast food. So yeah, sorry, that's why it's been so important on this end.
Thank you so much, Melissa.
Yeah, sorry, I'm like too emotional about this, but thank you all for listening. It means a lot to me. And I just wish there was more in regards to fitness for patients like me, because I am actually loving physical therapy, which is something I never thought I'd say in a million years, but I love it. Like I feel so much better when I come out, and I just did like my second eval yesterday, and I've improved so much, like from when I started after radiation in June. Like I have so much more motion, my arm isn't swollen, and I think it's just the diet and the stretches that made all the difference.
Thank you so much, Melissa.
Yeah, of
Really do
course.
appreciate you sharing your story. And I just wanted to see if anyone in the audience has any questions. Please feel free to unmute yourself and ask your question if you'd like. We'll just give a moment for that. Okay, if you don't have any questions, you can also put your questions in the chat and I can ask them as well. But we do have a few questions that were listed during registration, and I'll go ahead and start those. So this would be for Dr. Patel. This person stated, I have colitis due to Keytruda. So what specific diet can I eat?
I just lost the Zoom thing. Can you hear me?
Yes, I'm sorry, I didn't hear you.
Sorry about that. I was just having problems with my screen. So the patient's having diarrhea because of the Keytruda?
Colitis due to Keytruda, correct.
Colitis due to Keytruda. So, you know, that's really tough with that. And I think, again, my question for that patient would be what they were eating beforehand and how they were eating. I do recommend for a lot of my patients when they're getting chemo, during the weeks that they're getting chemo, just to eat more bland types of food. Yogurt is one of my favorites. Bananas tend to irritate the mouth a little bit less, but you replenish potassium and some of the other electrolytes with that, and rice. But again, with the colitis, I think a lot of it's going to be that while you're undergoing this episode, a lot of times in surgery, we recommend bowel rest and hydration and gently getting things back to normal, especially if you're having a severe episode of colitis.
Thank you, Dr. Patel. And the next question is for you as well. Can you discuss the effects of moderate alcohol drinking and breast cancer? Does the consumption of an occasional glass of red wine have any beneficial or negative effects post-treatment when in conjunction with the Mediterranean diet?
So we typically recommend no more than 4 ounces of alcohol a day. And the thought on wine is that there is something called resveratrol in it. It's an antioxidant or something called a polyphenol, which an antioxidant helps prevent the cells from in your body from getting damaged. So again, the recommendation is 4 ounces of red wine for that reason.
Thank you. This one's for you as well, Dr. Patel. Does consuming more sugar put a person at higher risk for cancer?
Consuming more sugar does not feed cancer cells, but the concern is that it does cause inflammation in the body if you're eating excess sugar in your diet. So it's those inflammatory changes that are thought to increase cancer risk and the risk of diabetes and cardiovascular disease.
And Dr. Patel, are there any specific foods to avoid other than sugar?
So saturated fats, that's bad for your heart health. So we want less than 20 grams of saturated fat a day. And again, when we're talking about sugar, remember, we're also saying not to eat too much simple starch in the diet. So remember that starch is a chain of sugar. So that's something to just be mindful of. Also minimizing things like fried foods, things like that. Very important.
And this person had a few questions, but they gave a little background. So I'll read the background first and then the questions. I have a BRCA1 gene and was diagnosed with breast cancer. During chemotherapy, I developed heart issues, thyroid issues, and high liver enzymes. Now I am on 6 different types of medication to manage all this, and I was told that it's for life. Are there really herbal supplements and vitamins that can help fight cancer? What are ways to detox your body from home after chemotherapy? And how do you manage or eliminate side effects from chemotherapy?
So it's kind of a tough question because I don't know the medications that the patient is on. So if there's been severe liver damage, chances are that this person may be on steroids. I don't really know the exact details of what happened or what the chemo regimen was. But again, I think, you know, you can try to balance your diet, hydrate well during chemo. It helps most patients, but then there are some people, unfortunately, who will have that reaction. And unfortunately, there's no magical supplement or anything in the diet that will help reverse anything. You know, it's just unfortunate. I wish there was, but really the best we can try to do is balance our plates the way I discussed and try to be as active as possible.
Thank you, Dr. Patel. Next question is for you as well, and they did give a little background. I was diagnosed in February of 2024, completed treatment and mastectomy in January of 2025. Before I was diagnosed with breast cancer, I added collagen peptides to my diet for joint and skin care. I currently do not add any supplements to my diet, and I have arthritis. Is there any supplement I can safely take to support my healthy lifestyle?
So it's okay to have the collagen, just so you're aware, the collagen is going to be broken down into the amino acids, which help with building protein in the body. So just going to go through the natural digestive process like you do with any protein. So that collagen is not going directly in your body that you have in your diet. But that being said, it is a good source of protein and there's nothing against taking that. So if you feel good with the collagen supplement that you're taking, that's fine. Really, the only thing I recommend is a multivitamin with iron. If you take that with 4 ounces of 100% fruit juice, you'll absorb more of the iron. And then there are some patients that may be vitamin D deficient. So if you are, you should be taking vitamin D with calcium. And sometimes that may need to be prescribed by somebody. But I don't recommend any specific supplements. There's a lot of companies that are making these turmeric supplements and mushroom supplements and everything else. And to be perfectly honest with you, they're expensive. They're not approved by the FDA, and a lot of times they're chemically modified. So you can get a lot of these herbs and things naturally in your diet. For the turmeric, you should have no more than 1 teaspoon a day, especially if you're taking tamoxifen. It can interfere with the medications that you're taking. And also during chemotherapy, you have to be aware of potential interactions. So again, things like turmeric and cinnamon, be very careful and no more than 1 teaspoon a day.
Thank you. The next question is for you, Dr. Patel. What supplements do you recommend to ensure we are getting all the nutrients we need? I've heard food today doesn't always have the same nutritional value as our grandparents' food.
So if you can get a rainbow of vegetables and fruits on your plate every day, you won't need any supplements. And the only thing I would recommend is that multivitamin with the iron.
Thank you. And we do also have a question in the chat from Margot. Hello, I just had blood work yesterday. My white blood cells and red blood cells are low due to for zero. What do you recommend to eat and drink to bring up the blood cells back up?
So for the white blood cell count, I think the oncologist actually will give you an injection to help. And Dr. Obeid, I should let you comment on that. I don't want to steal your thunder on that question. And if you, as far as the red blood cell count, a lot of times your body will recuperate. But again, if you can make sure that you're eating foods that are iron rich in your diet, that will help a little bit. It's not going to help 100%. But again, he's the oncologist and I will not step on his toes.
I'm totally in agreement with Dr. Patel. So for the white blood cells, we typically give agents that would stimulate your bone marrow to release white cells and produce more white cells. But for the red blood cells, usually if you need to eat more iron-rich food.
Thank you, Dr. Reed and Dr. Patel. This next question is for Dr. Patel. I had an ER-positive breast cancer tumor diagnosis after taking enzestrol for the recommended years. Is there still some protection offered after menopause?
So the medications for hormone-positive cancers are thought to have protective effect for 15 to 20 years. That being said, for certain cancers, your oncologist may recommend 10 years of these medications. So there's benefit for 10 years in certain patients, but the 5 years confers a 15 to 20% risk reduction in recurrence.
Thank you, Dr. Patel. And the next question is for Dr. Obeid. Do I need to go to the hospital to get genetic testing for BRCA and any other genes?
Not at all. You don't need to go to the hospital. In fact, a lot of the places actually you have to visit the doctor's office in order to get the genetic testing done and potentially have the blood drawn. At the Hennessy Institute, we are trying to make things as easy as possible. And we will be sending or shipping the saliva test to your home. Through the Hennessy Institute, you can get most of the things done virtually. So it's by getting things, on your phone, being called by the nurse navigator, and they would let you know about the process. And then there will be shipping of that saliva kit to your home. Be aware that but there is about 10 to 20% failure to the saliva kit. So if it fails, then we would opt for a blood test instead of the saliva kit. But for the majority of individuals, they're getting their tests done through just that saliva.
Thank you, Dr. Obeid. And we do have the link in the chat if anyone is interested. And I do see that we have someone with a question. Melinda, please feel free to unmute yourself and ask your question.
Good afternoon.
Good afternoon.
Good afternoon. I just got diagnosed in August with triple negative breast cancer, and I've been receiving chemo since September. So the first treatment, I got 3 medications, and I had a lot of digestive issues, like gas and a lot of burping, and my stomach was hurting. I tried to drink a lot of water. I think I was getting dry mouth as well. I was drinking beet juice and I was juicing and I was eating a lot of fruits and stuff like that. But there's some times where I have cravings for sweets. So I do have sweets sometimes, but I do try to eat a lot of vegetables. But when I got my treatment last week, the third medication, it gave me a lot of digestive pains again. So I want to know, what can I do for them pains that's in my stomach? It's not often. It's only when I get the third medication. And it's like I'm burping. It's like my stomach is hurting a lot. Even if I'm not eating, the pain just come and go.
How long after that third medication are you having the problems?
Like I would say right away, like when I got the third medication on Wednesday,
Mhm.
as I was getting it, my stomach started getting hot, then it stopped. So by the next day, that's when I started getting stomach pains. And I've been having it ever since last week, Thursday, until I would say today. I really don't have it today, but I did have it yesterday. So I would
So
say for a week,
are you getting what is the break between the chemo doses that you're getting? Like how often are you getting the chemo?
once a week.
So you're on a once a week. So is it the Taxol, the Taxotere that you're getting right now?
Yes, it's three of
Um,
them. I know
and
one I only get every 3 weeks.
so you're getting Keytruda as well?
Yes.
And is it after the Keytruda that you're having problems?
Uh, I think I think so. It's the one that I had every 3 weeks because the other ones I was fine. It's when they give me that third one is when my stomach starts to hurt.
So have you talked to your oncologist about that side effect that you're having?
No, I'm gonna tell them tomorrow when I go in.
All right. So that's the first thing. I think you need to talk to them. Sometimes you may need something. I don't know if it's an antacid or something. Again, Dr. Obeid, I might lean on you for this one because I don't think there's any food that will specifically help her with this issue. I just don't know if she's got like a gastritis or something with the Keytruda.
Yeah, typically, I mean, she's getting carboplatin and paclitaxel and the Keytruda, and I think all of this is potentially affecting her probably stomach. And typically, what I would first do is potentially treat for potential gastritis. So anti-acid medications, you can try with once a day or then try twice a day and see if that would help. And if you're feeling that your bowels are gassy, you can probably also use Gas X, see if that would help. If any of those remedies did not really help, then your oncologist would need to adjust the medication or the dose.
Okay. So my diet, right? Like I said, I eat sweet sometimes. I eat out, but not as much. I've been eating home since this happened. Every so often, maybe like once a week, I may eat out. Should I not eat out at all and only eat in the house? Since I'm the one cooking the food?
I don't think there's any issue with you eating out. I will tell my patients that when they're feeling better, I mean, usually most of my patients, the weeks that they feel better, the weeks that they're getting their medications, and that's when I tell them to eat more of the bland diet. As long as the food is cooked properly when you're eating out, I mean, that's the key thing, right? You don't want to get any raw type of food or anything from outside because you don't know how that's been prepared. So definitely fresh vegetables, things like that. You should clean them at home and eat them yourself. And I have no objection to you eating sweets. I tell my patients 85% good, 15% bad. So if you feel like you need it, I mean, you deserve it. It's just that I don't want every single meal to be a cupcake for you, right?
Okay.
But on the weeks that you're feeling better, the more protein and the more balanced plate that you can get, the better. And in the weeks that you're feeling lousy, I think sticking with the bland diet will help. And then I think you should definitely talk to your oncologist and make sure you don't need an antacid or something else.
Okay, so walking, like I like to walk. So I try to take an hour walk at least three times a week. Is that good or should I be doing it more? Cause
That's one of the best things that you can do for yourself. So the more people can exercise, and it's really hard when you're getting chemo. So there's going to be times when you feel absolutely lousy and you want to be in bed and you want to rest and you should do that. But the more that you can walk and the more active you are, it's actually going to help you through your treatment and you're actually going to be better prepared for when it's time for your surgery. One of the worst things I see for my patients who are not able to do much during chemotherapy is that they're completely deconditioned when it comes to surgery time. So they have a harder time recovering. So you're actually doing something good for yourself, but don't push yourself too hard to where you're going to pass out or something, right? You want to walk
yeah.
as much as you can tolerate.
Okay, and drinking. Like I haven't had alcohol since I found out about my diagnosis. But in a couple of weeks I'll be having a 50th birthday celebration at a venue. Am I allowed to have champagne on my 50th birthday? Am I allowed to toast?
Um, so Dr. Obeid, I'll let you answer. I don't think it's an issue with a couple sips depending on timing.
Okay.
So when you're getting chemotherapy, you can think that most of the chemotherapy that we give gets metabolized through the liver. So basically, when you get the chemotherapy, your liver is working hard to get all the toxins out and adjust whatever we need to give you and to stay in your body, and not to lose more or keep more of it. So if you drink alcohol, then you will be distracting your liver or even making your liver work faster. So either or. And so that's why we tell our patients to not drink alcohol while you are taking chemotherapy. Now, for your 50th birthday, if you want to have one drink, I think you can have one drink, provided that one drink is not a big glass, a small glass of, whatever your favorite drink is.
Okay, thank you. I
Happy
appreciate your help.
birthday.
Happy birthday.
Thank you, thank you.
Any other questions? Please feel free to unmute yourself and ask your question. Okay. Dr. Patel, please feel free to go over our programs that we have. So we have that anti-cancer lifestyle program and your Dr. Roshani Patel supplemental programs.
So the anti-cancer lifestyle program was founded by somebody I made friends with actually before I left New Hampshire. She is a 23-year stage 4 breast cancer survivor. And when she was diagnosed with stage 3 breast cancer. And what she found was that there's really not a lot available for what's in the environment that could have led to her cancer, just her survivorship. So she's worked with a group of people. And there are some free resources that you can use at your own pace. They also do have an online support group, which you can utilize. But it's a really good tool and it's free. So again, this is something that you can use at self-paced, and they're doing a lot of good work. And then we do grocery tours at the Belmar ShopRite. They're going to start again in January. We do ask that if you do register that you show up, because we do a lot of food prep the weekend before, and we don't want things to go to waste. So please confirm that you are coming. Usually it's the 4th Tuesday of the month, and usually my secretary will call and double check if people are coming. But we'll go through the store and point out some things if people have specific questions. But basically what I'll do is I'll prep an item based on the handouts that we give in the office to show people how they can make a balanced meal. Any other questions? So if you want to register for the ShopRite tour, we have it through online. You just have to scan the QR code. You should be able to register. So if you look at our online, and I think somebody just shared the link. Anything else?
Thank you, Dr. Patel. So if you don't have any other questions, I'll just go over some of the key takeaways. So lifestyle and environmental risk is where you have the most power to make a difference. Know your screening plan for early detection. And when making your plate, remember 35% vegetables, 15% fruits, 25% protein, and 25% grains. This balance supports a stable blood sugar and provides cancer-fighting nutrients. Keep in mind how much fiber and protein you need daily, and limit your sugar and sodium intake. Stay hydrated, and exercising regularly can reduce your breast cancer risk by 25%. Thank you, speakers and the audience, for your time and participation.
Thank you for inviting me. I hope you guys have a great rest of the week.
Thank you, Dr. Patel, and thanks everyone. We appreciate it.
Thank you, guys. Have a great day.
Thank you, you too.
Have a great birthday, Linda.